Yes, for our next presentation, we've got a tag team from some folks at U.S. Meat Animal Research Center. We've got Dr. Alexandria Snider, who is a research physiologist. She did her graduate work at Oregon State University and a postdoc at Nebraska-Lincoln. And she works in the area of the impact of nutrition on reproduction. And then our other speaker for this part of the session is no stranger to PIF, Dr. Mark Thallman. Is a beef cattle geneticist and co-leader of the germplasm evaluation project at USMark, and has a long history of research in the area of statistical genetics and genomics and those applications to beef cattle breeding programs. So with that, we're excited to have you guys joining us by Zoom, and I believe Dr. Snider will be leading us off.
I will. Thank you so much for that introduction, and apologize we can't be there in person, but thank you so much for your time today. And I know both Dr. Thallman and myself are very excited to share with you the uses of advanced reproductive technologies and the inclusion of these records in genetic evaluation. So to go ahead and get started, to give you some insight, some seed stock cattle are produced via embryo transfer, which the previous talk did a very nice job discussing this a little bit. And they are actually excluded from the National Cattle Evaluation. So a topic entitled Embryo Transfer, Data Collection and Utilization was recently added to the Beef Improvement Federation guidelines. My hope for the next 20 minutes is to define the terminology and various forms of embryo collection and transfers. And also we'll discuss the relative advantages and disadvantages of this technology on genetic enhancement within the beef industry. As you can see here on this figure to your right, this is an overall view of what's involved in getting embryos for an embryo transfer. As you can see, we have superovulation, in vitro fertilization, cloning as was discussed in the previous talk, all to develop embryos for a transfer program. And I will be breaking down this big figure into smaller pieces to really get at how do we get these embryos for transfer. So in order for transfer, we need a recipient. And for embryo transfer, the latest rates, as you can see here, that are used for numbers that I got in 2019 from the International Embryo Transfer Society. And as you can see that MOET, which is multiple ovulation embryo transfer, these embryos are a lot fewer transferred than embryos that are produced via IVF, which is in vitro produced. Now, these embryos are going to be transferred into a surrogate female that would be a recipient. Now, in order to select your recipients, there are 4 criteria that you can use. The first one is to ensure that she has a good body condition score, because you don't want them to be too heavy or too light. And the same thing applies when you're going in for a breeding program as well. You want to make sure these females are normally cycling, that they have an estrus cycle each month, because if they are not cycling normally, you're going to have a greater chance of a failure of conception. Want to also ensure these recipients have good maternal traits, and you can use the lower genetic merit females, as they are just going to be gestating that embryo that you're putting into them. And these females will gestate and raise embryos derived from MOET or IVF. Now, once you selected your recipients that will get an embryo, you're going to need to undergo a synchronization. Now, the synchronization protocol that you can use is up to the producer, and it's really up to whatever the producer wants to use for their program. The main important part of the estrus synchronization is monitoring for estrus activity. And you monitor for estrus activity by looking for standing heat, as you can see here, or you can use heat detection aids. For example, patches, as you can barely make out here on this cow in the background, has a bright pink patch. The purpose of this is day 0 is considered our onset of estrus, and we will then count out 6 to 8 days in order to put our embryo in. In normal in industry, we try to go for approximately day 7 as the target transfer date, because that is the stage embryo more led to blastocyst that we would be transferring. And the figure down here shows a nice description of what's all involved in the embryo transfer with selecting our recipients, undergoing a synchronization through estrus detection, transfer, and then about 30 to 40 days after your transfer, you can determine pregnancy diagnosis, either rectal palpation or ultrasound, to determine if your recipient took that embryo. Now, with this, after we select a recipient, then we need to think about how are we going to get these embryos. So currently in industry, there's two main ways of embryo production, either multiple ovulation embryo transfer or IVF. Now in these figures, it shows a nice representation of the number of embryos that are produced worldwide. As you can see, the number of embryos has increased over time, and we continually to see that increase. When we break up the number of total embryos into embryos that are derived from either MOET or IVF, we see here in 2019 a big difference from where we're getting our embryos. So more embryos are being derived utilizing in vitro fertilization techniques than being collected from donor cows using MOET. Now, when we look at the number of transfers for frozen embryos, now, mind you, this is from a few years ago, we do see that these MOET embryos have a higher percent of transfers than embryos derived from IVF. But I have a feeling that in these next few years, this number of IVF embryos will either match the MOET or increase past MOET. Now, you might be asking yourself, what is MOET and how is this performed? Well, MOET stands for multiple ovulation embryo transfer. And there actually are different definitions that are used for this procedure, such as flushing, in vivo derived, conventional embryo transfer, and in vivo production of embryos. These females would be selected as your donors, and these donors would be of high genetic merit that you want to select to breed to a high genetic merit sire. And you can increase the calf crop of the specific sire dam mating. And these numbers down here just show how many females were collected and embryos collected from those females in 2019. Now, this procedure is very involved as these donors undergo a superovulation treatment. This treatment requires multiple injections of follicle stimulating hormone, which is abbreviated as FSH. And you would give approximately 4 days of injections, with doing the injections twice a day, morning and evening. After these injections, you would then induce estrus with an injection of luteolase to allow those multiple follicles that are growing on that ovary to ovulate. Because in a normal cycling female, she ovulates one follicle at a time. With FSH injections, we're actually developing multiple follicles on that ovary to get her to ovulate 10 to 20 eggs at once. Then you will monitor for estrus detection, and you will AI either one time 12 hours after onset of estrus with multiple straws. And the purpose of that is, again, thinking about the fact that we have multiple eggs that are being ovulated, and we're trying to maximize our fertilization of those eggs. Or what you can do is breed one straw multiple times at the onset of estrus, 12 and 24 hours afterwards. Then you will wait one whole week and come in at 7 days and do a non-surgical embryo collection, also known as embryo flushing, is where you flush the uterus with media to collect all of the morula embryos or blastocyst embryos that are there. And these embryos are graded by a trained technician to determine their quality on grade scale 1 through 3. And then they will also be graded based on their stage, either a morula or blastocyst. These grade 1 morula or blastocyst can be transferred into timed recipients if they are available at that time period. Or these embryos can actually undergo cryopreservation and used later if no recipients are available. With MOET, there are pros and cons, and just to describe some of those for you. The pros of Mowat is these embryos are gestating in an in vivo environment. So they're not being cultured in an incubator. The donor female is doing the incubation process and allowing for a better early embryonic development for these embryos. And these donors can be collected multiple times between pregnancies. The only caveat is that you need to wait 45 to 60 days in between collections. You can't really shorten that collection window because that would cause some stress on that ovary. There are cons with using this is with a superovulation treatment, you can get variability in the response in your collection. Some collections can look like this picture right down here, where you can obtain 15 to 20 all grade 1 Morula and blastocysts. Or they can look like this picture right here, which was collected from a female, where we only got 4, 2 unfertilized ova, a degenerate, and a grade 1 Morula. So that's one of the main cons of using Mowat. And also donors cannot be collected when they're pregnant. And you also have to, again, wait that 45 to 60 days if you are going to breed them. So while Mowat has its benefits, there is another technique that is even more commonly used and was definitely discussed in the previous talk, which is in vitro fertilization, also abbreviated as IVF. And another definition that is used as well is in vitro production of embryos. And this method is involved with collecting oocytes or eggs, utilizing 2 different methods. The first method is doing an ovum pickup or oocyte pickup. This is where you would have a donor female that you will take a guided needle and aspirate her follicles, or you can collect ovaries from an abattoir. Now, a good example of this is if you have a prize heifer that has great genetics, but she has an injury, a physical injury, and she's incapable of making it to the breeding season, you can actually collect her ovaries and collect the oocytes from those ovaries, mature them, fertilize them, and freeze them in order to still get embryos and hopefully potential calves out of that prize winning heifer. And here is just listed some numbers in 2019 of how many donors, oocytes, and transferable embryos were collected in utilizing either OPU or an abattoir. So for the procedure of IVF, this process, as I described earlier, involves collecting the immature oocytes from small antral follicles, as you can see here on this ultrasound. Again, either utilizing an oocyte pickup technique where you take an ultrasound guided needle and aspirate each follicle, or you have the ovaries in the lab and you aspirate them. Once those oocytes are collected, they are pooled with an animal and they are matured for 21 to 24 hours in an incubator. This process is called in vitro maturation. After in vitro maturation, these matured oocytes will then be transferred into an IVF dish, and sperm will then be added into there and allow for 18 to 24 hours for fertilization to occur. This is where the IVF term comes from, because it's in vitro fertilization. And on this video here, to show you real quick, this is what's actually occurring within the dish. So you add 1 to 2 million sperm in with the matured oocyte, as you can see here. And you can see the sperm are actively trying to fertilize that matured oocyte in the well. And then after the 18 to 20 hours with the sperm, these presumptive embryos are precisely removed. The cells around the presumptive embryo are removed and allowed to culture in an incubator until they reach the morula or blastocyst stage. And this whole process is called in vitro culture. Along with traditional IVF, there is another method that was also discussed in the previous talk, which is the intracytoplasmic sperm injection. This technique is performed after IVM has occurred. This procedure is more complex than traditional IVF. This is because the cumulus cells are stripped from the surrounding oocyte, and this is right after maturation. and a single sperm is injected right into the cytoplasm of the oocyte, as you can see here, to ensure that fertilization has occurred. You would use this if you have a bull that you really want to use of high genetic merit, but his motility may not be the best for IVF. This is where you could use ICSI. This procedure is more time consuming and expensive, and it requires great technical experience and equipment to perform this procedure. Now, just like with Mowat, there are pros and cons with IVF. The pros are that you can collect these donors even more frequently than you can with Mowat. They can be collected twice a month and also during early pregnancy as well, as long as you can get a hold of the ovaries. You can have greater overall embryo production per cow because you can be collecting more oocytes and fertilizing them in vitro. And you can also monitor early embryonic development of these embryos as well. The cons, however, for using IVF is you do tend to see a 10% reduction in both pregnancy and cryopreservation rates of IVF embryos. There is a lot of research that's being done to see how we can improve IVF embryos to improve conception rates and their ability to have better cryopreservation. So they might even have a higher percentage than Mowat-derived embryos. Along with these two techniques of IVF, there is another method of IVF that is really commonly used in Australia, and it's not as commonly used in the US at this point. And this is juvenile in vitro ET, also known as GIVIT. And GIVIT is collecting oocytes from prepubertal females with high genetic merit. So this is if you have an embryo transfer heifer that you really like her genetics and you want to shorten that genetic interval instead of waiting 2 years, you would take a prepubertal heifer and she would have to undergo a superovulation protocol to develop antral follicles to go through either an oocyte pickup aspiration or a laparoscopic aspiration because she has not reached puberty yet. The benefit of this technology is to shorten the generational interval to 1 year on the female side. So instead of having to wait 2 years, by using this technique, you can shorten it down to a year. Now, another technique for generating embryos, which was discussed earlier, is nuclear transfers. It's also commonly known as somatic cell nuclear transfers or cloning. This is a process that entails the removal of the nucleus, as you can see here in this figure below, from the oocyte, and you would insert a nucleus from either a somatic cell from a donor animal or a cell from an early stage embryo. And this would either be an 8 or 16 cell stage embryo, because you can take one single cell from that embryo and transfer it into a donor oocyte. Then you would allow for artificial activation to then that potential embryo will then develop to the blast stage, and then thusly you can transfer it. Uses for nuclear transfer embryos. This technique is developed to develop genetically identical individuals and predominantly used in donor cells of high genetic merit individuals as well. They can propagate desirable genetics or specific individual has died or become infertile. And the most common use for this technique is to facilitate gene editing that was nicely described earlier. Now that we have our embryos, and let's say we don't have a recipient available to transfer, we then will utilize cryopreservation. The cryopreservation can be used for morula to blastocyst stage embryos, but we can also cryopreserve oocytes. There are multiple different methods of cryopreservation, such as a stepwise cryopreservation, where you take the embryo through multiple washes. However, when you go to thaw that embryo, the embryo has to thusly be thawed in multiple washes again prior to transfer. The other method is direct transfer, which the embryo can be thawed and directly transferred into the recipient without the need of a microscope or any washes involved in that. The final method of cryopreservation, which is becoming more common in industry, is vitrification. This is more commonly used for oocyte cryopreservation and is starting to gain traction for embryo cryopreservation as well. This technique is an ultra cooling of highly viscous solutions that form a glass-like state around either the oocyte or embryos, as you can see here, to avoid crystallization. So when an embryo undergoes freezing, there is a possibility for crystals to form that can penetrate into that zona pellucida to hinder the quality of that embryo. And finally, when you get these embryos, especially ones that you generate in the lab, you can undergo sex determination and genotyping. So this technique can be performed during very early stages of development. And this is if you want to know the sex of the embryo prior to transfer, or if you want to know the specific genotype of that embryo as well. So the method involves either removing a small blastomere from the 8 or 16 cell stage, as you can see here on this figure, or you can take a piece of the trophectoderm off at the blastocyst stage and utilize that as well. So for my part of the presentation, what I really hope that you took away is that there are multiple different methods available for you to use with embryo transfer and for generating embryos to apply these assisted reproductive technologies. And that assisted reproductive technologies provide a very useful tool for improving genetic selection within your herd. And with that, I will stop sharing my screen and I will transfer this over to Dr. Thallman and he can take it from here.
All right, I really wish that I was there to visit with you about this in person, but I'm still glad to have the opportunity to talk about a topic that's fairly important to me. And it's actually so important that, as you can see, it was a topic of my master's thesis a long time ago. And as I was starting to work on guidelines for use of ET data, I realized that it was actually barely mentioned in the BIF guidelines previously. And I think the role that ET plays in genetic improvement is often underappreciated. So I hope it was useful for you to have an overview of the various forms of the technology and terminology associated with them. And I really appreciate Alex doing that for us. So I'm going to share a little bit more of my personal history with you than I normally would, because I think it's a little bit relevant to the talk and to some of the biases that I've interjected into the current form of the guidelines. So before joining US Mark, I spent 10 years working for 2 cattle breeding companies that used ET extensively, where I was responsible for collecting, assigning contemporary groups, submitting, analyzing, and performing genetic evaluation on performance and other traits on more than 15,000 ET calves and more than 20,000 non-ET calves of 7 breeds. I did donor cow and sire selection, matings on thousands of ETs, thousands of non-ETs, and hundreds of the first nuclear transfer cattle that were produced in the world. And associated with that, I had responsibility to personally inspect and characterize most of the first 100 of those calves that were born anywhere a couple times a week and took detailed notes on any abnormalities that we saw. And did other things related to working in a registered cattle operation as well. So I have to confess, I have no personal experience with IVF as it was not widely used while I was working in industry. And I'm eagerly seeking feedback from people who have more recent experience with ET than mine. But I'll confess that for issues on which relevant information seems lacking in the scientific literature, my contributions to the guidelines are substantially influenced by experience that's more than 25 years old. So recently, BIF approved guidelines on the use of records from calves produced by MOIT, IVF, and MT. And I'm going to summarize those real briefly here for you, or at least some of the more important aspects of them. And so but I'm going to talk really about two main topics in those guidelines, and that is use of records from various forms of ET. And so the guidelines are that we recommend using records from MOIT in genetic evaluation. And we recommend not using records from IVF and nuclear transfer in genetic evaluation. But we do encourage actions that could allow IVF records to be used in the future. I'm going to talk about that quite a bit. And I do want to point out the guidelines are that it is okay to use records on progeny of IVF and nuclear transfer cattle in genetic evaluation. The second topic is how we treat clones in genetic evaluations. And our recommendation is to treat them as being genetically identical instead of as full sibs. Alex showed you a different slide on the increasing use of IVF. This is beef transfers in the US. And I presented this graphic to the guidelines committee to consider in conjunction with our recommendation to not use records of IVF calves in genetic evaluation. That was a topic that we discussed at length and considered very carefully. It's hard to recommend not to use them when the technology is rapidly replacing MOIT. And Alex explained the reasons that, or some of the advantages of IVF. I just want to say, kind of looking at, having looked at ET from the breeder's perspective, that the ability to collect embryos from cows that are pregnant, to freeze those embryos, transfer them during your normal breeding season, and keep your donors in that preferred breeding season is a really big deal. And so we understand why IVF is increasing in frequency. But there's reasons for concern with the records that I'm going to discuss in a minute. And I just had a note on here that I think that probably part of the reason that IVF is increasing in use recently is that breeders can get an evaluation of genetic merit from genomics. And I wonder whether breeders feel that they actually need the boost in accuracy of having ET records included. Personally, I want all the accuracy I can get, and I think having records included is important. But I am looking for a lot of feedback from breeders, and this is one of the issues I'd like some feedback on. So I can't see it, but I would like a show of hands of how many people in the audience know what large offspring syndrome, also sometimes called large calf syndrome, is. And well, I can't see, I would predict that the majority of people who raise their hand are either involved in the embryo transfer business or some closely related business, or are breeders that use embryo transfer on a large scale. But I think it's important for all of us to be aware of large calf syndrome. This is something that can occur in calves that are produced by nuclear transfer or IVF. The severity has a very large range. Many calves are either not affected or minimally affected, but when they're affected, calves can weigh up to twice as much at birth as an unaffected calf of the same genotype. They can have increased gestation length, dystocia, abortion, higher postnatal mortality rate, and a wide range of congenital abnormalities, especially hydrantosis. The phenotypic differences due to large offspring syndrome are less pronounced with age, but are still quite noticeable at a year of age. And all of these things were evident in the very first set of nuclear transfer calves that were cloned from embryos and that were born in 1986. And that first set was a set of 4 identical Brangus bull calves. And the largest of those calves weighed about 155 pounds and died at or shortly after birth. The other 3 of those calves lived a normal lifetime and I think weighed in the range of 75 to 90 pounds. The largest calf that I've ever seen was a nuclear transfer calf that weighed 198 pounds. Was born to a straight Brahmin recipient cow, if you can believe that. And that calf had a clone that weighed about half of his weight. And it wasn't always the case that the range was twofold, but it certainly wasn't atypical to have calves that weighed twice what you would expect a calf of that genetic makeup to weigh. And so that's the reason that I spent a lot of my time characterizing those early calves. You know, when the first calf came at 155, we wondered what was going on, but we thought it was just a fluke. But as time went on, it became clear that there was a portion of these calves that just weren't normal. And we spent a lot of effort into figuring out why that was. And unfortunately, didn't get that far while I was there, but over the last 35 years or so, there's been significant progress there. And as time's gone on, so when IVF calves came along and began to be produced commercially in substantial numbers, it was thought that some of them also had large offspring syndrome. But I think that the assumption was that in IVF, it occurred either less frequently and or less severely than in nuclear transfer calves. But recently, it's been suggested in the literature that IVF and nuclear transfer calves share a number of abnormal characteristics, but there's a separate set of abnormalities that are common in nuclear transfer calves, but occur rarely, if at all, in IVF calves. And those characteristics are listed in a couple of papers as failure to initiate parturition, enlarged umbilical cord that required clamping and sometimes urachus surgery, respiratory problems, lethargy, contracted flexor tendons, and other congenital abnormalities. And I can assure you that all of those things occurred in the early nuclear transfer calves. We're calling these additional abnormalities abnormal clone syndrome, but there does not really seem to be any consensus in the literature that I found for a name for it. But just to have something to refer to in the presentation, that's what we're using. So there's been a lot of improvements in culture media, oxygen concentration, and other aspects of the techniques that have been reported to reduce the frequency and or severity of large offspring syndrome over the past 35 years. There's a recent review paper that I cited in the proceedings that indicates quite a bit is known about specific abnormal epigenetic modifications that contribute to large offspring syndrome, or ACS. And I think it's possible that these epigenetic modifications could, and maybe already have, provided markers in embryos that would predict the extent to which large offspring syndrome would affect the resulting calves. And I think that if we could get a development like that, it could have a big impact on the technology. First of all, it could allow discarding embryos that are predicted to be most effective, and that possibly could improve pregnancy rate as well as reducing large offspring syndrome. And it also could greatly accelerate research into the causes of and mitigations for large offspring syndrome by being able to quantify the effect of changes at the embryo level rather than at the calf level. So I think that there are prospects for eliminating or reducing, sorry, I'm talking about abnormal calf syndrome here. So that's a little bit different deal. IVF and NT embryos are subjected to relatively similar culture conditions from the one-cell stage until transfer at about day 7. There are a lot of avenues to make culture conditions more similar to the conditions in the cow's oviduct and uterus. The disparity with natural conditions is thought to be primarily responsible for abnormalities that are common to IVF and nuclear transfer that comprise large offspring syndrome. But the process of transforming a somatic or embryonic cell into a much larger equivalent of a one-cell embryo, which is what's needed in nuclear transfer, is very different from IVF. It requires fusing the donor cell with an enucleated oocyte and hoping the oocyte cytoplasm will reprogram the DNA inside the nucleus to the state of the desired one-cell embryo. Consequently, the efficiency of getting to a transferable stage is low, and it's amazing that that ever works at all. So the prospects for reducing abnormal clone syndrome, which is what's different in nuclear transfer, are a lot less promising than for large offspring syndrome in vitro fertilized calves. In the process of putting these guidelines together, it became apparent that some of the things we needed to do required different nomenclature for referring to contemporary groups and their effects than what are in the current BIF guidelines on contemporary groups. And that and other problems with contemporary definitions in other sections of the guidelines prompted us to begin the process of revising contemporary group guidelines. And Matt Spangler and I had a presentation on that in the Genetic Prediction Committee yesterday. The parts of that that are relevant to our discussion today are that there should be a big difference between groups of animals that are contemporaries and the contemporary group effects as we use them in genetic evaluations, and they probably should be used in genetic evaluations in ways that they're not because of trying to share a definition between these two things that inherently should be very distinct. And so the current guidelines list many effects that contemporary groups should be divided on. And we propose that those effects should be estimated in genetic evaluation, and breeders should designate contemporary groups as groups that were managed together regardless of sex, ET, twin, previous contemporary groupings, etc. So that's important for answering a lot of questions about ET records, like are AI, MOIT, and IVF all equivalent, or are there differerences in means and variances between those? Are there differences between calves that result from fresh versus frozen pregnancies? There's fairly strong evidence in humans that there is. Are there differences between whether the donor was treated with FSH or not? We really don't have good evidence for that, but FSH certainly causes more degenerate embryos, and things that affect early embryonic development have been shown over and over again to affect phenotypes later in life. So I think there are good prospects for accommodating IVF records in genetic evaluation if enough of the right people are committed to do the things that are required to do it. It's going to require enough records with the right structure. It's going to require substantial additions and modifications to genetic evaluation models. I've got 3 different ways in which we could think about doing that listed here. The first is to just identify and eliminate records that are clearly affected by large offspring syndrome. A more sensitive, but maybe more complicated approach would be to weight records less as the evidence that the calf was affected by large offspring syndrome increases. And finally, I raised the possibility that there could be some sort of biomarkers that would give us an indication of the extent that large offspring syndrome affected an embryo. I talked about assaying that at the embryo level earlier, but it could also be assayed and perhaps more effectively assayed in a newborn calf. But there'd be a lot of work to do on determining the appropriate tissues, et cetera, for that. I think this is an important goal, but it's going to require action by breeders, ET service providers, breed associations, and genetic evaluation service providers. And so the question is it worth doing? The other topic that I wanted to address briefly is fitting clones in genetic evaluations. I'm not talking here about using their records in the genetic evaluation. I'm talking about how clones are fit in the pedigree of a genetic evaluation and the impact that that has on the EPDs of the clones and of their descendants. And breed associations have treated this in two different ways. Some of them fit the clones as genetic identicals, and the way that they do that is that within the pedigree of the genetic evaluation, they just use the same ID for every genetically identical animal, and that's fairly straightforward to do. They still maintain separate registration numbers within the registry system. Other associations just use unique IDs for every animal, and in that case, clones have the same parents, so they're treated as full sibs. And we had a fairly lengthy discussion about this, and I can understand the idea that if we treat them as full sibs, we let the data tell us whether they're really genetically identical or not. The problem is we don't have anywhere near enough sets of clones to answer that question in that way, and it creates an enormous number of problems. And so in the end, I think that all or most of the guidelines committee came down on the side of recommending that clones be fit as genetic identicals, and that's what the guidelines now say. So there's a lot in the proceedings that I did not have time to cover. I've cited a lot of literature, including some recent reviews on various topics, especially large offspring syndrome. Modeling records of ET animals, that encompasses the bottom point of maternal effect of the donor cow, recipient effects, suitability of MOET records for inclusion in genetic evaluation, gene editing, and the use of records produced by AI or natural service from donors after they've been superovulated repeatedly. So if you're interested in these topics, I would refer you to the proceedings that accompany this presentation. And to wrap up, I will assert that embryo transfer is a valuable tool in the genetic improvement of beef cattle, and that calves produced by ET comprise a disproportionately large share of ancestors of C-stock animals. BIF recently adopted guidelines recommending that records of most cattle produced by multiple ovulation embryo transfer be included in genetic evaluation. There are many questions about using ET data in general, but specifically in genetic evaluation that can best be answered by analysis of field data. And I think we should consider whether that's worth the effort to get it done. So I have a few questions for you, the audience. Is using records on IVF calves a priority for breeders? And is reducing large offspring syndrome a priority for breeders? And then how many records on MOET and IVF calves that can be identified as such are in breed databases currently? And could they be identified as contemporaries so that relative effects could be estimated? And can they be identified as contemporaries to non-ET calves so relative effects could be estimated? And with that, I'm going to close. I don't know whether we have time for questions or not. Alex and I would be happy to try to answer your questions, but what we'd really rather have is your feedback and your experiences with using especially IVP that's more current than what my experience is. Thank you very much.
We're seeing more transfer of all beef embryos into dairy cows. And if either of you have any insight on on whether those calves might potentially be able to be included as animals in an evaluation? Or do they see the issue of the large offspring syndrome in those beef calves and dairy cows?
So I don't know the answer to the second part of that. But as the guidelines stand, we would recommend that embryo transfer calves be produced in registered cows that have preferably had previous calves with records reported. And that'll give us a cleaner evaluation of that calf's genetic merit. But we also recognize that it's not practical for everybody to do that. And so there is a provision for using commercial cows as recipients. And in my opinion, those Holsteins would certainly qualify in that way. And to some extent, we know whether a cow's a Holstein or not. And so there's not really an issue of guessing what the breed composition of the recipient is. And so in some sense, those Holstein cows would be a more consistent recipient than particularly if we went to a sale barn and bought beef cows. So I would not have a problem with that at all. And I don't see a reason that it's going to make a difference in large offspring syndrome. And I'll just share about half of the recipient cows that I dealt with were Holsteins. And we saw relatively little difference between Holstein and beef cows as recipients.
All right, well, let's thank our speakers again for joining us remotely. We appreciate you being able to do that.
Thank you all.
Yep, thank you.